Hello everyone, my name is Jen Nolan and on behalf of Musculoskeletal Australia, I'd like to warmly welcome you to our webinar on hands and arthritis this evening. I would like to begin by acknowledging the traditional custodians of the land from which we are broadcasting, the Boonwurrung people of the Kulin Nation, and pay my respects to their elders past, present and emerging. Musculoskeletal Australia would sincerely like to thank Janssen Australia for their sponsorship of this evening's webinar, which has enabled us to offer it free of charge. It's important to state, however, that our sponsor has had no editorial control over the content of tonight's webinar. On behalf of Musculoskeletal Australia, I'm very happy to provide you with our list of free community webinars for 2022. We have a great and diverse list of topics and issues, including fibromyalgia, osteoporosis, joint surgery, complementary therapies, and the impact of musculoskeletal conditions on intimate relationships. To make it easy for people, everyone who registered for a Musculoskeletal Australia community webinar this year will be automatically registered for our series in 2022. We will, however, be in touch with you in the coming weeks with further details about this. If you haven't previously viewed Musculoskeletal Australia's website, I strongly suggest you do so. In line with our focus on empowering consumers through education and support services, we have a wide range of information, videos, webinar recordings, tools and services, including our national helpline that is available via email and phone on 1800 263 265. Also, while you're visiting our website, check out our new online shop. It has a wide range of aids, gadgets, books, and other resources to assist you in your daily activities. I'd now like to introduce our presenters for this evening, Josephine Gibbs-Dwyer and Ellie Fitzgerald. Josephine is an occupational therapist, an accredited hand therapist awarded by the Australian Hand Therapy Association. She completed a Bachelor of Applied Science Occupational Therapy and also a Master's of Occupational Therapy. She also undertook a hand fellowship in Houston, USA. Josephine will be assisted tonight by Ellie Fitzgerald, who has recently completed her Bachelor of Applied Science Occupational Therapy. I'll now hand over to Josephine and Ellie. Many thanks to you both.
Thanks, Josephine, for that introduction.
Thanks,
Hi, everyone. My name is Ellie, and I'm incredibly pleased to be here today presenting. I'd like to thank everyone here for attending the webinar tonight, and especially thank Musculoskeletal Australia for hosting the event. Today's presentation is Caring for Your Hands While Performing Daily Living Tasks. Our goal is to provide helpful hints to assist with the management of daily living tasks. These hints presented will be general, and it is important to visit your medical practitioner and/or rheumatologist to confirm the diagnosis of arthritis. I would like to acknowledge the traditional custodians of the various lands on which we gather today and pay my respects to the elders past, present and emerging. I extend that respect to the Aboriginal and Torres Strait Islander peoples who may be participating today. I'd also like to announce a medical disclaimer that this presentation is designed to give general information and advice only, and if people are required to receive specific advice, it is recommended they seek advice from a medical practitioner or accredited hand therapist. Now, an accredited hand therapist is a person, is an occupational therapist or physiotherapist that has been accredited by the Australian Hand Therapy Association. Josephine and myself have done a large amount of study of the hands and upper limb to prepare for this presentation. So with 27 bones in total making up our hand, 8 of these in our wrists, along with muscles and tendons, our hands are important in helping us complete daily living tasks. We must do our best to protect these the best way we can, but where to start? So what is arthritis? Arthritis is a condition that results in inflammation of the joints, which can cause pain, swelling, and stiffness. This can impact a person's movement, which may affect their ability to perform daily living tasks. It is fairly common, with 1 in 7 Australians having some form of arthritis within their lifespan. There are several different types of arthritis, These including, but not limited to, osteoarthritis, rheumatoid arthritis, fibromyalgia, gout, and lupus.
The bone has 27, the hand has 27 bones, 8 of which are wrist bones. I'm wondering if you could look at your own hands now as I go through the movements of the hand. The fingers move as a hinge joint into flexion and extension, and they can move apart and come together, abduction and adduction. The base of the thumb here is the saddle joint, and it allows the thumb to move in abduction. I'll just put it so I hope you can see this. So out to the side, opposition. Can you, let's see, I'm just getting the camera on myself. Opposition, so your thumb touches the tip of the index, middle, ring, little finger, and down to the distal palmar crease. A normal bone is where 2 bones, can you maybe, I think, go on to the next slide, Ellie, please? Great, thank you. A normal bone is where 2 bones are connected. At the end of the joint, there is cartilage, so you can see that on the left. A joint capsule surrounds the bone, and this capsule helps to stabilize the joint. The synovial membrane is the lining of the capsule, and that releases synovial fluid that lubricates the joint. Osteoarthritis is wear and tear of the joint and of the cartilage. The cartilage becomes thin and the bone ends rub together. Bony lumps may appear, and these are called, at the tip of your fingers, Heberdin's nodes, and at the middle of the finger, the PIP, it's called a Bouchard node. The rheumatoid arthritis inflammation causes the synovial fluid to thicken, causing pennus, and the joint becomes swollen and warm. Pennus is an extra growth in your joint that can cause your bones and cartilage and tissue to be damaged. Cells in the pennus relieve enzymes that may destroy the cartilage and the bone. Tendons and joint capsules can become inflamed as the knuckles, which may cause fingers to swell and also to ulnar deviate. So with this, the ulnar deviation, the metacarpals across here have become lax and the fingers are drifting to the ulnar side. That's called the ulnar side because the bones in our forearm, on the thumb side we have a radius, and on the other side it's called an ulnar. So that's why that's called ulnar drift. Thanks, Ellie.
Just got a short video explaining rheumatoid arthritis further.
Rheumatoid arthritis is a chronic inflammatory disease that typically causes significant pain, swelling, stiffness, and deformity in joints. Symptoms are often most significant in the body's smallest joints, such as the metacarpal phalangeal joints, where the fingers meet the hands, and the metatarsal phalangeal joints, where the toes meet the feet. The disease process specifically attacks the lining of the joints, called the synovium. The synovium is a thin membrane located within the thicker and more fibrous articular capsule, a flexible sleeve of tissue that surrounds the space between 2 or more bones that form a joint. The synovium produces synovial fluid, a thin, clear, viscous substance that bathes and lubricates joints. In rheumatoid arthritis, the body mistakenly sends white blood cells to attack the synovium, causing an inflammatory response. Rheumatoid arthritis generally progresses in 4 distinct phases. In the first phase, the synovium reacts to invading white blood cells, or leukocytes, by adding layers of new cells at a rapid pace. The new cells may cause the normally smooth synovium to develop a rough, grooved surface. Excess synovial fluid also gathers, causing the affected joint to swell. This inflammatory response often makes the joint warm to the touch. Skin over the joint may turn red. In the second phase of rheumatoid arthritis, the synovium continues to thicken and new abnormal tissue called pannus forms over the ends of the joint's bone surfaces. In the third phase, the pannus releases enzymes called lysosomes that can damage and sometimes completely destroy the surrounding cartilage, bone, and soft joint tissue. The space between the bone narrows, and joint alignment may be permanently altered, resulting in deformity. In the fourth phase of rheumatoid arthritis, after cartilage is lost, inflammation may spread to the surrounding tendons and the articular capsule, making it difficult or impossible to move the affected joint. Other symptoms of rheumatoid arthritis can include hard lumps underneath the skin, called rheumatoid nodules. These most commonly appear on or near the hands and elbows. Rheumatoid arthritis symptoms can occur in joints throughout the body, such as the knees, ankles, hips, elbows, and shoulders, as well as cause other symptoms, such as fever and fatigue. Rheumatoid
The common symptoms of arthritis include pain and aches, stiffness, swelling, reduced movement and strength, all of which can contribute to fatigue. Arthritis can also lead to joint deformities. It is really helpful to keep track of symptoms to discuss with your doctor or therapist to assist in making a diagnosis. Symptoms of arthritis may make people feel less useful than they normally would. They may feel they need to rest more during the day, and they may not be able to achieve everything in the day that they want to achieve because of the pain and fatigue that they feel. Persistent or ongoing pain can have a large impact on a person with arthritis's ability to participate in activities. It is important to keep track of the activities in the day that can cause you pain. Using a pain measurement scale, 0 meaning no pain and 10 being the worst pain you can imagine, can be an effective method to track pain levels to then discuss with your doctor or therapist. Keeping a diary of activities that cause you pain can be important in helping to manage it. There are lots of other steps you can take to manage pain. IMAX gloves, as shown in the image, offer mild compression and warmth that can assist with reducing pain in the hands. The fingertips are free to allow for feeling with the ends of the fingers. Some people get pain overnight, so wearing a finger splint at night can be a really helpful way to reduce pain. Custom-made neoprene finger stalls can be made by your treating clinician to ensure an appropriate fit. Upon waking up or just before going to bed, your fingers may be stiff and sore. Placing your fingers into a bowl of warm water and soaking them for a few minutes can really help reduce pain and may also increase your movement. Finger stiffness is incredibly common when waking up or going into bed.
Keeping a pain diary is a very helpful way of monitoring your pain and having a balance between rest and activity. It's an important, keeping a pain diary is important also to identify what triggers pain. The diary needs to include an activity that you've done, the time that it's taken, when you did the activity, and rating the activity from 0 to 10, just like Ellie was saying. You can use the pain scale and the location of pain. This will give you a baseline. And so if you start implementing ways of reducing pain and doing activities in a different way, this will give a monitor to see if that's been effective or not. Start with a short period of time when you're doing an activity and time how long it takes for you to do the activity. So you may decide that you want to do go for a walk. So time from the start of the walk until you get pain, and then you can have that as your baseline, and also have a goal of how much you would like to walk per session or per week. You need to work out 1 or 2 tasks that are important to you that you're having difficulty doing. Talk to your therapist also to set goals and strategies, and to remember to make them realistic. Discuss with the therapist the steps you'll need to achieve your goal. So break your goal down into small component parts. For example, if I wanted to cook a cake, my goal might be the first day to buy the ingredients. The second day might be to set up the utensils and the cooking ware required. The third day might be actually make the cake. So you're breaking up that activity so you're not causing yourself fatigue or your joints to be too tired doing a repetitive activity. And discuss with a therapist these steps to ensure that they might have another suggestion, or there may be an easier way, just to check that what you're doing is well established. As I said, the long-term goal might be to walk to a corner shop. So you can have short-term goals and long-term goals, and the therapist will assist with this. Thanks, Ellie. To plan your daily activities, I believe that Musculoskeletal Australia provide a diary for you to do this. It's important for you to balance your time for rest breaks between activities, again using your timer, so time the start and the finish of the activity, and also your rest breaks. Plan your day as well using a timetable, so your full day. Write down each step and the time required for the activity, and you may want to just do one step and then have a break and do a second step, say at another time during the day. In using heat morning and evening may help your stiffness and reduce pain during the day, which could have the ongoing effect of you being able to manage some more of your daily activities. Thanks, Ellie.
So here we've got some images of some different hand movements that you may do to complete certain tasks during the day. A person with arthritis may have effective movements which may impact function. So these images are not exercises, but just to demonstrate the different movements that the hand can perform, such as grasping, holding, and releasing items. It's important to discuss this with a therapist to see the extent of your hand movements.
These are common grips that you will use during the day. The first one is the pincer. You can see with these, they're nearly all involving the thumb, as we were discussing before. So the first one's called a pincer grip. So that's between your thumb and index finger. The second one is a lateral grip. So it's a different movement of your thumb again. The tripod grip is this grip here, and later on I know that for a lot of people a goal is to write and they have problems with a pen, so we'll show you how to adapt your pen grip, so that will make that easier for you to use to write rather than using the tripod grip. The next one is a spherical grip, and the last one here is a cylindrical grip. And that's one if you are holding, say, a newspaper. Be mindful too that you can change the grips in your hand. So it's not a static grip. You can change them according to the activity and according to the movement of your hands. Thanks. Protecting your joints is very important. It helps to maintain your joint alignment, and having joint alignment will also have a flow-on effect to improve your movement. It may reduce pain. Joint protection may involve also changing some daily habits. So again, this is another opportunity to use your diary to record when you do have pain, the activity, and then the way you're going to change doing that particular activity. Thanks. Energy conservation techniques are very important. Hands can get tired. I've seen and heard many clients who talk about weak joints and fatigue. So when you're doing an activity, think about the size of the activity and use the largest, strongest joints or multiple joints where possible. So rather than using, if I'm holding my mobile, to hold it well into my palm, not gripping it like this where I'm using the end joints near my nails. So actually with these you can get Velcro supports at the back, so your fingers can just rest like this, and that can stabilize the mobile. Use the largest joints and multiple joints where possible, and organize your space to reduce effort needed to prevent excessive reaching for objects. So if I was reaching out and getting something heavy, it would be much better for my joints to actually reach for that object when it's closer to me. So I've got the support of my arm and my body rather than putting the weight on my hand. Thanks, Ellie. It's very important to balance times of activity with suitable times of rest. I've got a couple of clients who do this so well, and they again have diarised when they have their rest time and their activities. So depending on the activity, it may require more rest after the activity. And also it gives your joints a rest. So some people like to, when they wake up in the morning, put their hands into a bowl of warm water because they're sometimes stiff, and then do some tasks, have a shower, and then maybe have a rest, and then prepare breakfast. So divide up your day according to your pain diary and your perception of your own pain. Divide the activity into small steps. So if you're doing a gardening, for example, your first step might be just to plan out where you're going to do the garden, and then to get the necessary equipment to do that. Your second step might be just to have a small area that you're going to work on and to maybe rake it. The next day, it might be to do some digging. Avoid lifting if painful and use an auto trolley, and reduce the amount of weight taken through joints. As I mentioned, relaxation prior to sleep can assist with a good night's sleep. So some people find it also helpful to do during the day, and we're happy to provide a relaxation script later on if someone would like that. Thanks.
So it's important to exercise your fingers and thumb to maintain your range of motion in a pain-free range. We recommend you discuss this with a therapist to seek advice for exercises, as everyone's range of motion is different and the needs you have may differ to another person. Therefore, it's really important to get a tailored, personalised exercise program if required. There's just some example exercises there. So there are a range of small changes we can make in our day-to-day living that can have a really large contribution to limiting the impact of symptoms of arthritis. Although you may not have problems now, it's all about preventing them for the future. So I've got some different examples, some helpful hints. Firstly, there are many low-cost aids that can be purchased to assist with several self-care tasks, such as showering or dressing. So, for example, some long-handled tools, such as a shower scrubber, shown in the picture, and a button or zipper aid, also the lower image, which can be really useful for fine motor tasks required for showering or dressing. When holding a cup, this is an example of a neoprene wrist-based thumb splint. This can be used to reduce excess stress through the fingers and thumb whilst holding a cup. Over here to illustrate the use of an aid, and this being another thumb splint, and the technique whilst making a cup of tea.
I find lifting up heavy things like a kettle with my thumb has caused a lot of pain, so I'll make sure I lift it up with two hands, make sure I've got the correct grip, the correct thumb position, and then I use two hands to pour it, and then also to then lift it up as well.
Perfect. This is such a good demonstration of appropriate grips and preventing taking excess strain through the hands there. Good sample.
I find lifting up.
Right. You can also use a kettle tilt base. This is in the lower image. To prevent lifting the heavy kettle altogether. It sits on a base that can be gently pushed or tilted with hot water into a cup. So it's a really safe way to prevent heavy lifting, obviously using hot water. So yeah, there's an image of using two hands to hold just a mug to prevent having the strength just through one hand. It's really just a good effort to make, just using two hands to lift a mug. When completing the shopping, holding a grocery bag over your forearm, like in the picture, instead of using a hook grip in your fingers, can prevent excess strain and weight through the fingers, those weaker, smaller joints in the hand. Also using a backpack or a trolley can be really useful as well. Also love to have a large key tag on your keys to help grasp the key to prevent that fine lateral grip. It's a bit easier with a large key tag, and it's also easier to locate your keys. There's also lots of options for large grip or adapted grip utensils that can increase independence during meal times for people with arthritis. These adapted utensils can aid with grasping and the functional use of a certain utensil. The larger grips also allow for less stress through those smaller joints in the hand and requires less grip strength for their actions. There's some examples there. As Josephine mentioned before about handwriting, similar to utensils, there are a variety of options for pen grip aids. These grip aids, there's a few examples on the screen there, can provide comfort and increased motor control of your writing utensil. And there's lots of options out there, not just the ones on the screen. When cooking, you can use tools such as jar openers, shown in the top image, to prevent those tight grips needed for opening jars. Really useful. And it's also really important to use two hands when lifting heavy items, such as a saucepan, to reduce straining from the weight up through one hand. It's just spreading the load over two hands. I also recommend using non-slip matting to reduce the need to stabilize items such as a mixing bowl. So you can use two hands on, say, a mixer instead of having to hold the bowl and the mixer, for example.
There are a wide variety of splints available for people to use to support their joints. My recommendation is that you consult a hand therapist, accredited hand therapist, to determine the best splint for you. And also hand therapists, accredited hand therapists can manufacture custom-made splints for your hand. Some of these splints, commercial ones, are fine, except some of them don't meet the needs of supporting the specific joint and the joint shape of the person who requires the splint. So the splints are worn to support the joints, and then they need to be prescribed with a specific wearing time. I don't recommend wearing the splints all the time. I recommend you speak to the therapist so that you know exactly why you're wearing the splint, for how long, and what the wearing regime is. So I hope that information is helpful for you. Thank you.
So our hands help us to do a lot in everyday life, so it's super important to look after them the best way we can. Our hands are our most valuable tool, and we should definitely not take them for granted. It's super important to plan your activities carefully and enforce and practice joint protection as much as you can. If you're looking for more information, Musculoskeletal Australia offers excellent programs and resources. Thank you so much for listening, everyone.
Thank you.
Thanks very much, Josephine and Ellie. I think you provided some very practical tips and ideas and aids there to really assist people in assisting their sort of mobility with their hands, but also managing the pain that can be associated, especially with arthritis in those small hand joints and so on. We have a couple of questions that have come through. So if anyone has any other questions, please type them in the question box now so that we can get through questions. I've got a couple of questions, and there's also a question that came through. Ellie, you mentioned early on about the IMAX gloves. You showed the IMAX gloves, and there was a question that came through, or a comment really. Someone sort of said that the gloves look great, but from their experience, they're really hard to get on when the joints are inflamed. Is there any comment you'd like to make about that? And in a way, seeing that comment come in early, I suppose the other option there Josephine, would be another form of splint or support rather than trying to actually get a glove on. So Ellie, would you maybe like to start with any comment there in response to that?
Yeah, that's a really good question. Thank you. That's really tricky. It's a really good point she's brought up. I would probably, as a therapist, I would like to watch them put on the glove and maybe see what the issue there is. And if it was too difficult, I would probably recommend something else, even just because it provides that warmth. Maybe doing the warm water bath might be better, or even just soft mittens, something just to warm up your hands. I would probably suggest that. Yeah, really good question.
Yeah, but from Josephine, from what you sort of said, it looked like maybe another splint might be an option if a glove was too difficult to actually put on.
Yes, my first sense of that is that I would see a hand therapist, accredited hand therapist, to watch what is actually going on when putting the glove on and off. I completely agree with Ellie. I think there are quite a few options. You know, woolen gloves can offer, that have got a lot of stretch, they can offer a lot of support. However, I'd be really just keen to see the hand and to watch the process. We didn't mention actually, to just with warmth of hands, wax baths. We use wax baths, we heat up the wax, and people can put their hands into wax and do that about 2 or 3 times. So you immerse your hand, take it out, immerse it, take it out, and then it builds up a layer over your hands. And you leave that on till it becomes cool, usually 10-15 minutes. And I have seen people with very stiff hands after the wax bath move their hands like they haven't moved it for a very long time. So I'm just putting that in. I know it's a little diversion from the gloves. However, getting that movement may also help indirectly with other activities like gloves, except I would go to a hand therapist. I would use a different sort of glove. And I think, like you said, Jen, there may be need for a splint to support splint the hand or joints at specific times, because splints are only worn usually for specific periods of time, not all the time.
Yes, yes. And I think that was a very good point you made, because I obviously sort of still having some moving the hand and even the affected joint is very important, rather having it immobilized all the time. So I think that was a very good point, rather than wearing a splint all the time, which, or as you sort of say, for a very clear period of time.
Jen, could I just make another point too, just a very brief one? I really think it's valuable to see a hand therapist, because I think from the people I've seen, once they see a hand therapist and they can identify exactly where the problem areas are and hear from the client what problems they've got, they can make up a really nice program and a beneficial one. Whereas if you're by yourself and you're struggling with pain or stiffness, it can just help so much. Even if it's just a few sessions.
Yes, yeah, no, I'm sure that's good advice, Josephine. And as we said at the beginning of the webinar, this webinar can only give people a bit of an idea of some of the options. Obviously, having a consultation with an accredited hand therapist would be best. I mean, for some people, the cost involved may be difficult, but even with 1 or 2 sessions to gain some advice, and hopefully maybe in a setting where the cost to the person is actually fairly minimal. We've had a question come through with regards to whether there's aids for assisting in driving, actually holding the steering wheel, turning a steering wheel. So Josephine, maybe could you respond to that in relation to, are there options in relation to assisting people who may have difficulty with their hands and need to drive?
You can get adaptations for cars. I don't know. I would go to an occupational therapist who's a driving assessor, because I know it's not arthritis, except I know there are adaptations for people who haven't got an arm, or do you know what I mean? They've lost a finger. So because I don't work in that area, I can't give a specific answer, except what I can say is that I would definitely contact an occupational therapist who works with driving assessments.
Yep. And also there was just a question, though, whether this might be more for someone with a medical background. What causes numbness, tingling, and stiffness of fingers?
That's a really good question. Do you want me to answer that, Ellie? Or
yeah, or is that more of a medical? Would that be for a medical practitioner, or can you respond to that?
Yes, I can. So I think, it's always good to have a medical opinion. We see a lot of people with tingling and problems with numbness in the hand, and with an examination of the upper limb, sometimes it can be anything from a compressed nerve at the neck, shoulder, right along the arm. It can be carpal tunnel. There's a lot of different areas that it could be, and I think it would be very valuable to see both your doctor, except also a hand therapist. And sometimes it's a matter of giving someone nerve glides or positioning their hand differently, or a splint. So it's wide, and it definitely needs a thorough assessment to work out what the cause is.
Okay, great, thank you. There's a question here about, do you have any thoughts or suggestions for using a keyboard and a mouse for a computer? Who would like to respond to that?
I can give it a go.
Yeah, Ellie.
There's a lot of different adaptations for keyboards. A lot of wrist, what would you call it? Like a wrist rest. It's a tricky word. Just to kind of prevent, like, it's all about the angles of the wrist. It can really, I guess, seeing a therapist would recommend what you need personally. But there's also different options like large font keys. So, you know, more spaced out typing of letters, as well as a mouse. You can get larger mouses as well. There's so many options out there, which is really incredible. Yeah, it really depends on the individual.
Any comment, Josephine?
Yes, you can get a vertical mouse as well that can be helpful. And I think also, like Ellie was saying, the keyboard can be flattened too, so you haven't got your wrist back. And just to keep a good eye on the time too that you spend on the computer, so that you have rest regularly, because that can just add to stiffness, you know, if you don't change your position on a regular basis. Jen, can I answer a question that I was asked about by a client?
Yes, yes.
But they said that they went to the doctor and the doctor said they've got a diagnosis of arthritis, and that was it. They were left with that comment. And so for that person, or for anyone that happens to, I really you don't need a referral usually to go to an accredited hand therapist. So unless they're working in a surgery group, you know, you'd need to check that out. However, there is a lot that can be done for arthritis, and, you know, the joints might be stiff, except we've also got a wonderful sensory system in our hands that usually, you know, that works a lot of the time for most people. So there's lots that can be done, and my advice would be make an appointment with a hand therapist.
Yes, no, that's a good point.
Don't suffer alone.
No,
is
no,
what I'm saying.
That's very true. There's a comment that came in. Someone said, "I love the zipper aid," and I must say, I'm thinking, looking through, watching the webinar, there's quite a few things. I'll have to go back and see if there's anything that we should include in our new online shop, because there's certainly some very, very excellent gadgets and so on that you have you know, talked about this evening. What happens when a joint gets arthrosis? I don't know if I've ever heard that term, arthrosis.
You look it up. I think arthrosis, stiffening, I think.
Yeah, listen, we'll keep moving on if there's no answer that comes through, and the person who asked that question, we can maybe respond when we send out the recording of the webinar.
I probably need more information.
Yeah, no, that's fine. We'll leave that one if it doesn't, if it's not immediately. It probably is more of a medical issue there. Is massage helpful in reducing pain? Josephine, what would you say about massage and whether that would be good to massage hands to reduce pain?
I think treatment of pain is very important. I think initially it's very important to have a diagnosis to work out what's causing the pain. And massage could be a good treatment. However, it's so important to know what's causing the origin. So it may be applicable, or you would need to know a little more about what's happening, except if someone has pain, then again, I would go to a doctor, and, you know, lots of physios too treat pain. There's pain therapists, and I would consult a therapist who specialises in pain, and there's a lot of therapy available to assist.
Yeah, and certainly on our Sorry, Ellie, I'll just say on our website, we've got a lot of information, also quite a few previous webinars that we have run on the issue of pain. So people could look at some of those webinar recordings. Ellie, did you have a comment in relation to massage and pain?
Yeah, I was just going to say that pain is obviously so individualized, and I think there's so many different ways to manage it. And if you try massage and it helps, I think that's the best way to go about it. If, depends on the individual, if it helps you.
Can I
That's
just
right.
make a statement there? I'd be a bit worried unless I knew what was causing the pain to just embark on massage.
But as we've learned from many webinars in the past, sometimes it may not be something sort of even physiological. The experience of pain is so individualised, and as they talk about the psychosocial approach to pain these days, there's interesting about the wax baths. Someone has asked where you can buy a wax bath from, but when you were talking about it before, Josephine, I wondered whether it's something that should only be done in the presence of a therapist, or would someone use a wax bath at home? I would be concerned about the heat of the wax if people weren't experienced in using such things. What's your comment, Josephine, there?
Yes, actually, it's a very good point that you're making, because I don't know if wax baths are sold to the public or not. There is a lot of precautions that you do need to take when you're having a wax bath. So I think that there are some options around the wax baths that you can get, sort of like individual little wax packets, except I would go through a therapist. I was asked to supply one for home use. I ended up not doing it just because of the risk of a burn. So my advice would be to have one with a hand therapist and then see what they can advise for follow-up for warmth for the hand.
Great, thank you.
Jen, sorry, with the athro, that apparently it means osteoarthritis.
Right, okay, right, thank you. Thanks for that. With regards to, you mentioned before about the pain diaries and so on, which are a great idea. And I think you might have sort of said there might be a diary on our website. I'm not sure about that, but there are lots of pain diaries around, because someone sort of has asked whether there's any phone or iPad pain diary apps that people can use instead of handwriting on paper, which of course is a very important issue. So yes, there are several online pain diaries available. When we send out the recording of this webinar to everyone who registered, we will include a couple of links to online pain diaries so that people can actually use and access those. Another question here is hydrotherapy helpful in treating hand issues? Ellie, can you tell us anything about hydrotherapy and hand issues?
So hydrotherapy is the use of water for therapy services. I feel, in my mind, hydrotherapy is more of a full body thing. I'm sure it could help if you're doing hydrotherapy in a warm kind of pool, but I guess that's the same as just having a warm bath at home or a warm bowl of water just to warm up your hands. I think that's kind of the same thing that it's doing there.
I was interested before when you mentioned placing the hands in the warm water. I can understand that at the start of the day, just to sort of lessen the stiffness. Why would you do it of an evening before going to bed?
That's only if your hands are tired. Sometimes people also suffer pain overnight with their fingers. So they find if they've been doing a lot of work with their fingers quite flexed, it just relaxes their hands to do that. So it really is a bit of a trial and error. And then we mentioned those little neoprene sleeves that you can put on your fingers. Can I just make a comment about the hydrotherapy?
Yes.
I think it's very good for your hands. I think the buoyancy of the water, the warmth of the water will allow supportive movement. So it's a bit of a trial and error, except I think it's good for your whole, because strengthening and movement overall for your body regardless of arthritis and with arthritis is very, very important.
Yes, that's very important. I know for other people that we've dealt with through Musculoskeletal Australia who they just swear by hydrotherapy in lots of different ways. As someone's commented here, they find that warmth and gentle movement are the best things to help control pain. And I think that's one thing that sometimes people get a bit wary about. They feel that they're so sort of scared of experiencing pain that they actually reduce their movement, but actually movement is so important in pain. With regards to, so we've gone through the pain apps and so on. There's a comment about Raynaud's syndrome and the impact on hands. Josephine, can you tell us anything about that?
Yes, so Raynaud's, you can, gloves sometimes help with Raynaud's. So again, I would go to a doctor just to make sure to confirm that you have got Raynaud's, if you like.
Yes, actually, sorry, this person is talking, they've got rheumatoid arthritis and they've got secondary Raynaud's syndrome in their fingers.
Right.
So,
you can get gloves that will help. Again, I would talk to your doctor. I think it's a very good question. However, it's an in-depth answer, and I think it would need that person to visit a therapist to get the best treatment for that, because you can have gloves, except it's also the movement. It's what you do during the day with your hands, what assists you to reduce pain. It's I don't think it's it's not a straightforward answer.
And someone has asked whether
things can be done.
Yeah, great. Someone's asked where they can buy the jar opener, and I think that we would probably have a jar opener on our Musculoskeletal Australia online shop. So I'd suggest that person look there. Depending on where they live in Australia, given that we have people from different states viewing the webinar. I know in Victoria there's a group called Statewide. So if you, I guess if you looked up, what would you look up if you were looking up on the computer? What would you search for to actually find out whether there was a shop where you could buy some of these aids? What would you type in? AIDS or?
That's a really good question.
I had a bit of a research myself, obviously, and there's heaps online. You can definitely order them online, which is really awesome. I would search in even as simple as arthritis aids.
Maybe arthritis aids. Yep.
Or if there's a certain task you are wanting to do, you can write the task, say.
What's the name of the place in Warrnambool?
Arthritis aid. So many options out there, which is really cool.
Yeah. That's right. So that's very true too. Like just shower aids or gardening aids or writing aids, things like that. That's very true. Now look, we've come to the end of our questions for this evening. So, but you've really, oh yes, someone's mentioned the Independent Living Centre. I know that exists in Victoria. With regards to also someone said that the jar key is available at some kitchen shops or even at a $2 shop. So I guess, of course, it would need to be of good quality to actually work and take that pressure off the hands and so on. But the Independent Living Centre, which is obviously exists in quite a few, all states of Australia, is certainly an option. I think they certainly still exist in an online capacity, if not in a face-to-face shop. So, that's a few good suggestions coming in from people. Well, listen, on that note, we have actually reached the end of our questions. And that was some great questions coming in from people with regards to different things that they needed clarified from your presentation, or that they wanted further information on. So look, thank you very much, Ellie and Josephine, for your presentation this evening. It really was very practical, had lots of good advice and good, and like obviously the message is if people can afford it and they've got hands with the issues with their hands, seeing an accredited hand therapist would be a good idea. So hopefully people are able to manage that and so on. So look, on that note, I would sincerely like to thank you both very much. I'd like to thank the audience for joining this evening. As I said, the recording of the webinar will be sent out soon. We'll also be getting in touch with everybody in relation to our webinars for next year. Yeah, Josephine?
So just two brief things. With the cost of this, you can talk to your doctor about getting, there's a government scheme that you can get, you know, a certain number of visits. So
Yes.
it makes it more affordable. And there's quite a few therapists who work in public hospitals. And with the Raynaud's, if you Google hand therapist Raynaud's, I know there's some of the therapists who specialise in that area, and you can get a glove that's got little batteries in it that sort of warm the end of your fingers. So yeah, I know a little bit about Raynaud's, not a lot, except it's worth exploring that, just so you can be in touch with someone who does a lot of work in that area.
Yeah, great. Thanks very much for that. So look, on that note, I think we better finish up. We're right just before 8 p.m. This evening. So look, thanks everyone for joining. Thanks Josephine and Ellie, and to the other staff in the back end of the webinar this evening. I'd like to bid you all good night. This is our last webinar for the year, so best wishes for the holiday and festive season, and we certainly look forward to seeing you back in 2022 with our first webinar, which will be on at the end of February, but we'll be sending out further details about all of those webinars very soon. So on that night, I bid everyone a very good night.
Thank you. Thanks everyone. All the best for Christmas.